The data today are also relevant as we think about the next generation of trials, and we're going to be conducting a trial of inclisiran, a small interfering RNA, against PCSK9. This will be the ORION4 cardiovascular outcomes trial. And I think many of the principles that we have incorporated into the design were shown to be sound based on what was observed in Odyssey outcomes, namely that it does take time for those event curves to diverge, and so you're much better off having a somewhat smaller trial, but having a longer duration of follow-up to truly get to the, if you will, steady state benefit for intensive LDL reduction. I think the other lesson to learn is that while Odyssey Outcomes was certainly a success, it took a lot of sites, a lot of countries to do the trial. So over 1,000 sites in some 50 countries or so. ORION4 we plan on doing in just 2 countries, in the United States and the UK, with a far smaller number of sites, but have those sites enroll a very large number of subjects. I think that's probably the way clinical trials are going to go. But that's because we're enrolling a stable population. It's somewhat harder in the recent ACS. I think the trial certainly underscores that PCSK9 inhibition is safe, but that you need to maximize the duration of follow-up to see the benefit. And that in particular for mortality, it takes time for those event curves to diverge, which is why for ORION4 we plan on a median follow-up of 5 years.